Um, there are so many terms, right? I never knew those until I went through one. But there are various factors why a pregnancy can be affected. But you see a lot of young people, like young women, are going through PCOS, PCOD, endometriosis. What does it mean? Why does it happen? Do you think it's because of the lifestyle, or does it affect pregnancy or you being fertile in the longer run?
To an extent, as far as PCOD or endometriosis, or to an extent, low ovarian reserve is also concerned, or for that matter, male also. Lot of things are dependent on the environment,
Hmm.
the stress the person is undergoing, the lifestyle related changes, and epigenetic changes. So these are called as epigenetic changes. So there are generation will come with only 28 tooth. The 4 molar tooth, the last 4 molar tooth will not be there because consistently the jaw is becoming smaller and they are being removed by the dentist. So these are called as epigenetic changes. So similarly, there are changes happening in the genetics of the gametes, and these are predisposing the future generation for certain diseases. Now, if a lady is born with polycystic ovary, okay, so there are multiple eggs. Now, if she's very thin and lean, certain percentage, she will have a little irregularity in the period, and after giving certain medications, she can ovulate. That should not be a problem for her. If a problem is the date not coming on time, with the parents are worried about, one medication can be taken for 5 days in a month and she would get her cycle regularly. But if somebody comes with a BMI of 30, that will promote polycystic ovarian syndrome or metabolic syndrome, which could be very dangerous for that woman to become pregnant, because that will push her into, during pregnancy, increased risk of abortions, increased risk of diabetes during pregnancy, blood pressure during pregnancies, twin pregnancy during pregnancies, and all these will affect the maternal outcome. The maternal outcome in the sense unnecessary cesarean sections. Her weight can be a problem. She will land up with infection, or the child can be have to be born little earlier because the mother's condition is not so good because of the weight and other things. So these all things need to be taken care of. But typically, if you tell a couple or a man, you stop smoking or stop drinking or reduce your weight, first thing they do is they change the doctor. They ask question, we have come here to have a baby, and this stupid doctor is telling me to first lose 10% of weight. There are other people more obese than me become pregnant. I say, understand. I understand, completely understand. On the pack of cigarette is written the risk of cancer is there. Whether you smoke or you don't smoke, you will have the risk. Then why it is posted there? It's very clearly written there, no, that you will have a cancer, or you may have a cancer or increased risk of cancer. So the obesity per se will push you into some complication sometime. If you want to take a chance, you take a chance. And that's how with IVF centers, if you see, the other chain of centers is NICU. Neonatal intensive care units are increasing because we are delivering high risk pregnancy patients. So nobody is looking at that aspect. So IVF is one financial aspect. The second is the NICU aspect. And then baby going in an ICU at 30 weeks or 32 weeks, developing some kind of complication later date. All this is becoming one after the other, one after the other. You need to find a proper solution for getting this sorted out.